everyone. Welcome back to PHAMCAST. It's just having an engaging discussion here with Dr. Kristy Prouse about precision screening and lifespan and health span and AI diagnostics. It sounds, really surreal and almost futuristic, but it's not. It's here, it's now, and it's in Canada, thanks to companies like RegenaLife. And Dr. Kristy Prouse, you are the Chief Medical Officer of RegenaLife, and we've been talking, about the cutting edge testing that they're doing on so many levels, layering that in also with patient education and lifestyle medicine with your incredible team. One of the things you brought up was the early detection cancer, and anytime the word cancer comes up, it certainly strikes a chord in everyone. We know someone, at least one person, if not many, that gets that diagnosis or is in fear of that diagnosis, and there are many. Let's talk about that test a little bit more. You said that it will detect how many cancers?
51 plus different types of cancers to varying degrees. The sensitivity does differ from cancer type to cancer type. Those cancers that are encapsulated and not necessarily exposed too much to shed their DNA into the bloodstream are more difficult to detect. So things like thyroid, melanomas, prostate, where there are many others. So we're talking about quite significant detection of a whole range of cancers that we don't have screening tools for.
Wow.
Right? So in conventional medicine, we will screen for cervical cancer, breast cancer, colon cancer. Some people, they may do targeted prostate screening, and then lung cancer for some as well. But the reality is that we routinely screen for 3 cancers in Canada, when the vast majority, we're talking about 70% plus, are all these other cancers. And so, when you combine our typical screening and you're adding this to the mix, you are picking up on a lot that we otherwise were missing.
Incredible. So when patients come to RegenaLife and they go through their screening and they do the various testing, can you speak to, of course in just a generalized way, the reactions? And I want to look at this through the lens of recognizing that it can be scary, as we talked about in the other segments, to get information, because now what do we do with it? And it's not, typically we're in a reactionary system. And so now when people are getting real diagnosis, or not diagnosis, but real data about their health on a piece of paper, what are the reactions like, and what are you seeing as a physician, and how are you handling that? How is RegenaLife handling that?
Yeah, well, I think there's a whole spectrum of why people want to have this information, right? So you've got the biohacker who, believes that they are completely healthy and wants to do everything to remain that way. But there's a really big chunk of people who have ongoing concerns, be it from a family history of cardiovascular disease, or multiple family members with cancer, or they saw their grandmother die, with Alzheimer's. So there are definitely those 3 things where people can get really fixated on the risk, the possibility of it happening to them, maybe even fixated to an unhealthy degree. But I think it's important to know that we all come to the table with different ideas about what that information is going to provide to us. The biohacker is great, and I think that's just a really cool area when people take such interest in their own health and are wanting to look at the nitty-gritty. Those group of people find it absolutely fascinating.
I bet.
Right? And then of course there are those that are going to get a screening test that is positive, and it may be that they suspected that, or it may be that they didn't suspect that. And when you're anticipating something, I guess in some ways you've almost prepared yourself for it to some degree. It's really the people that didn't expect the findings.
And maybe are asymptomatic.
And that can be, tough to hear, but I think that's also where it's really important in how a message is delivered.
Yes.
And the hope that can come with this, because we aren't doing these tests so that we can. It's a death sentence. Not at all.
Not.
The idea is to detect something early when we can do something about it, and do something about it with the least amount of intervention.
Right.
Right. So people's response to it can be a whole broad spectrum, from anger to sadness to, but I think really, again, one of the important people in a medical relationship is the physician and or practitioner that is delivering the information and how they deliver it. We talk a lot about placebo effect, right? Which is actually a very powerful phenomenon.
Right.
And if you get 30% of people to respond, but there's also something called the nocebo effect. And we can have a negative impact on our patients, right? So when you frame the delivery of a message in such a way that you can actually make positive changes to delay a diagnosis or to avoid it altogether, and somebody really hears it and understands it, that can be game-changing.
And I think you're raising such an important point because, and this isn't the fault of many doctors, they don't have the time. And tests like this is not the mindset that we've been raised in terms of our healthcare system. And so you're absolutely right, but for you to recognize that, claim it, and know that the people delivering these messages at RegenaLife are doing it with that sensitivity, lens, and empowerment to it, it does make a huge difference, because otherwise it can land on deaf ears or create more anxiety and issues because someone is not ready to hear it. Yeah. That doesn't mean they're still not going to get the diagnosis later, but it is about putting them into action. So it's really, I think this is a really important discussion to have, because this whole mindset piece as we age, and when we talk about longevity, Dr. Prouse, I know you do a lot of work with women and hormones and aging, and when you feel like your life has been taken over, and you're going through menopause and an alien has taken over, you have such an incredible way to give the facts, wrap it in the science, but then do that work, and I'm not even sure you know just how well you do this, but then take it to the next step where the action piece, but with the support, feeling of support that you've got this, we've got your back while you're doing it. Can you speak to that? Because you did have to bridge the gap from going from, conventional medicine as an OB/GYN surgeon, and I know you've told me people have thought you were crazy. Yes. What do you mean you're leaving the hospital and you were going to open the Institute for Hormonal Health? Can you speak to how you manage that overall? Because this is what RegenaLife is doing, and why it's a really critical piece to this. Otherwise, it can leave people feeling even more stressed and alone.
Absolutely, and a big part of that is empowering the patient.
Yes.
And I'm a big believer in visuals, because when you see yourself on paper, you can't ignore it.
There you go.
So that's your call to action. There's something there. I can't deny that there's something there, even if I'm feeling okay. This is where you need to go. And I think, the other thing that I'm a big believer in is education.
Yes.
And I'm always amazed at how willing and capable my patients are at following through with instructions. Because I know that a lot of these, protocols that we're asking patients to do, I know they're involved. But if you understand why you are doing it, and so there's the education piece. I don't necessarily expect that my patients are going to remember it, 10 minutes from now.
Correct.
But they understand in the moment the why behind doing what they do. And if they've got their own personal why behind it, those two can be a very powerful combination, and empowering a patient to really take hold and take authority over their own health and any medical conditions that may be lurking.
Well, and you do that so well with the education piece and the visuals, and taking complex topics and synthesizing them in not a demeaning way whatsoever, but in a really deep understanding way and an empowering way to say, okay, we've got a problem. Now what's the solution, and how are you going to be part of that solution? And I think that, as a society and in terms of the healthcare professionals, if all of us can play a better role, I believe in that. That's why we have this show. That's why you're a guest here often, and why you're a FAMBassador in the preventative health movement, because that educational piece, I think we've really forgotten for a very long time in the healthcare system and in the psyche of people. Oh, I don't want to question my doctor, or I don't want to ask a question. You actually encourage it. And when you don't understand something, you'll repeat it. You'll show a diagram. You will, whatever it takes. And I think that is a game changer. And, if from the patient lens, somebody coming to see you, and I got to laugh, because the first time I met Dr. Prouse, the entire time I was sitting in the chair, because I finally felt like I was getting answers. The angels were singing because finally somebody was listening, and I thought I had some hope, because that's what you brought me. But in my head, I'm thinking, oh my gosh, I've got to talk to her about doing education for the masses, because she's going to be able to help others. How do you help patients? What is your advice to patients in this situation where they may be going to RegenaLife to get their testing, or maybe they're going to have to speak to their doctor and request that they want a different type of test that maybe conventional medicine isn't offering? How do you bridge that conversation and gap? Because you are the physician and the functional medicine doctor, but you also have that real sensibility of the importance of patient empowerment and education, and you're not threatened by that.
No. And I think patients really do need to own and be their own advocates.
Yes.
Right? And I do understand how it can be difficult to go against the grain. We have been raised historically anyway to put doctors on a pedestal. I don't think it's quite that anymore.
Right.
Which is totally okay. That's not a problem. But at the same time, this isn't about your doctor. This is about you and your health, and getting educated and getting information and accessing tools that are available to you, just maybe not available to you through the system that we've become accustomed to. So I think there has to be, some degree of courage for those that are feeling intimidated by talking to their doctor about it. But it really does, it comes down to education as well. Like, you may have to step out and not just solely rely on what your doctor's been telling. Medicine is moving ahead at great speeds. I can't keep up with it in many ways. I've always been really grateful that I have specialized in a very niche area, because I can stay on top of that. But doctors that are family doctors have a big responsibility.
They sure do.
Over a lot of different areas that they need to know about, and so that job is becoming increasingly more difficult, and I think we need to recognize that as patients, that the doctors are human too.
Absolutely.
And
working under a system that's strained or collapsed, and resources that are limited, and all of those things, and therefore having an idea, like writing your questions down in advance, or you've read about something, not Dr. Google, but you've watched PHAMCAST today and you've heard about this cancer test, and you want to have a discussion with your family doctor. Should they be scared to do that, Dr. Prouse?
No, they shouldn't.
Correct.
They shouldn't.
However, they may get some pushback, because that's the reality. Whenever we're making inroads and change, and it really disrupts the status quo of what everybody's been used to. Of course it comes resistance, but we both know on the other side of resistance often comes success and advancements, in whether it's in medical science or whatever it is. It's really important. And I think that giving permission for patients in a respectful way, and don't get me wrong, I have massive respect, as do you, for all our colleagues in conventional medicine. They're doing incredible work.
Absolutely.
But there is a place for all of us, including the patient, and these conversations, I think, are necessary to have, so that when tests like this that are cutting edge and that are truly prevention-based and early detection-based, they play an amazing role, but now we have to give the patients a voice. And that's the hard and often the disconnect. They'll stay more quiet and just listen. If I've had $1 for every time a patient said to me, well, I don't want to upset my doctor, and my doctor said no. Just because they don't know it doesn't mean that it doesn't exist.
Yeah.
So get the research, get the information. Can RegenaLife provide, I'm sure, information about these tests?
Yeah,
so people
absolutely. And I think what's really interesting about the 3 signature tests anyways is that we're really taking technology that already exists in some way, shape, or form, and enhancing it, right? So I think as science and our much greater understanding of how the body works at a cellular level is advancing, sometimes there is a delay in that translation to the medical practice. And so there's this big research application gap that can happen. But that does seem to be narrowing. And we just need to be open to, and at the same time, discerning about what technologies and treatments are of value and what are not.
And who's delivering those tests or that education. Because, the RegenaLife team are high-level professionals with lots of experience, clinical experience and other, versus just getting something, on Instagram that you think, is the best and the greatest thing. I think that's really important to be discerning as well. This kind of bridges the gap to talk about something we're both involved in, and it speaks to changes in medicine and healthcare, and the way doctors are going to be trained. Just this month, Toronto Metropolitan University School of Medicine in Brampton, where my clinic operated for 30 years, so excited that they have opened their doors to a new medical school. And this medical school is going to be different than any other medical school, because not only are they, of course, going to be training future doctors, they're going to be actually training them in preventative and integrative medicine, as well as patient-focused and looking at societal impacts. And Dr. Prouse and I happen to both be on the curriculum advisory board for that school, which is an absolute honor for me as an allied health professional. And Dr. Prouse, you have a voice at that table. What is that like for you? Looking back, and I'm going to be candid, that first day we sat at that table, and there was, doctors and surgeons and specialists and myself and massage therapists and researchers and people from the university, and we were all telling our story and why we were here and feeling this project was important. Well, if you know me, I can cry when something I'm really passionate about, and I had tears. I don't want to share your story, Dr. Prouse, but I think there were a few tears there as well. And I want to speak to that because I want to hear what it felt like for you, being an OBGYN and working in the conventional medicine, taking a courageous leap to open the Institute for Hormonal Health, and long before it was cool to do so, and now leading the charge hand in hand with RegenaLife, and being able to have a university like this, have a medical school where we're able to bring some of this back to the table in the research. So future doctors, this is where things change.
Yeah.
How did that feel? What was that like for you?
Yeah,
I witnessed it.
Yeah, I know. It was a whole mix of emotions, actually, that was really difficult to tease out. There was a lot of excitement there, of course, that goes without saying. I think I experienced the more than a decade of blood, sweat, and tears that have gone into what I'm doing, released in one moment, because I never thought I would see this next wave of change happen in my lifetime.
Yeah.
I really didn't.
Yeah.
And so to think that there are academic institutions that are taking this seriously and implementing it for the next generation is just kind of mind-boggling, and what a breath of fresh air. And this is where, when you start making systemic changes, that's what matters.
Absolutely. And it takes the pioneering thought makers like you with the courage to go first and to welcome others to the table and to embrace others like me, where we're working better together, and then together with this movement going and lobbying government for investment, lobbying with insurance companies for investment in prevention. That's how legacy change in healthcare happens, and thanks to your leadership and going first in a lot of ways in this country, you're able to come to this table today to talk about RegenaLife, its cutting edge technologies that they're bringing to Canadians, and then giving us all hope for the future, that all of us will have an opportunity to live with health span and longevity, and change the course that we're on right now, which is shorter lifespan, not living well. But we're going to leave this show on that note, on a positive note, that together we can change the legacy of healthcare. Everyday Canadians, conventional medical community, change makers in government, allied health professionals like myself, and corporations and businesses like RegenaLife, who are literally going out there to help us change the way we're going to practice medicine in the future, and making the patient at the center and helping you become the CEO of your health. That's what preventative health awareness movement is about. Dr. Prouse, thank you so much. As always, I learn from you, I grow with you, and together I feel honored to truly be able to bring others and join the family to make changes for the future for our kids,
right,
and future grandkids, because my son just got married. I had to put that in there.
Yeah,
because the future is going to be bright, but we have to be part of the solution, not the problem.
Better together.
Better together, indeed. So until next time, remember, a healthy tomorrow begins with prevention today. Stay well, and we'll see you all soon.